All right. Well, thanks again, folks, for joining me today as I interview on behalf of the Cardiovascular Digital Health Journal, Dr. Robert Califf, former FDA commissioner and head of policy at Google and Verily, a real expert in the field of digital medicine, and joining me today for several conversations about different topics in the digital cardiology space. So thanks for joining me, Dr. Califf.
Great to be here with you, Dave.
So in this segment, I want to address something a lot of our viewers are likely thinking. So many of the viewers of this video would be authors in the journal, folks who read our journal, who are interested in conducting digital health research. And in many cases, the technologies that they want to work with are built by companies that you've worked with successfully. And I'm wondering if you could first comment for them on what you're seeing in terms of successful mechanisms for either individual faculty members interested in conducting digital health research or health systems, examples of successful collaboration between academia and the digital tech space.
Well, that's a really interesting question. And, I would say the fundamentals of this are no different than the academia industry interactions that have occurred traditionally. The best way to be able to interact with an industry is to be an expert in the field so that you know as much as anyone else and you have something to offer to the industry. The industry typically will be interested, in developing products which then generate revenue. And if you're an expert, they're going to seek you out to collaborate. And I'll comment there that when I came along, we were just figuring out how to treat heart attacks. I know that's hard for youngsters to believe, but we didn't. I was actually taught in medical school that blood clots did not cause heart attacks. And then some ingenious cardiologists did some acute angiograms as I was a fellow, and lo and behold, there was a blood clot, the culprit to go after. And it was really obvious to me that getting 3 to 5 year NIH grants and going through all those review cycles was probably not going to be the best way to tackle the leading cause of death and disability in the world. A lot of that is useful for the research that goes into the background upon which products are developed. But if you want to treat heart attacks, probably better to work with the industry that's developing the products. And that's what we did. Fortunately, our university really supported it, although there were a lot of people who felt it was an inferior form of research because it wasn't NIH funded. And I think people will run into the same thing today. And one of the things that I think has changed is that academic medical centers, if you had a contest on who's more money conscious, I'm not sure who would win that contest between the industry and the medical centers. Just talk to your average assistant professor who's getting called in, about the number of RVUs that are being generated. And so I don't really see this as higher ground on one side. And I hope that academic medical centers will get more facile at becoming partners, just like I hope that technology companies will get better at integration. Because let's face it, the technology is way ahead of its application now. The real issue now is not the technology, it's how do you integrate it into routine life in a way that's beneficial to patients. So I'm actually very encouraged, but the basics are still there. Become an expert, become knowledgeable, and I don't think collaborations will be that hard to find.
So that's a fantastic and kind of inspiring perspective on things, Dr. Califf. So if I'm looking to, for example, if I'm an industry company interested in and with expertise in applying artificial intelligence algorithms to a particular signal stream, predicting outcomes, that requires data sets. And in a lot of cases, health systems, as you've correctly pointed out, there is no one American health system, but at least, and they certainly protect your health data as if there are many and it's theirs. How have you seen, what do you see in terms of the landscape of the ways in which digital health tech with these very advanced algorithms and processes that you use for your banking and many industries outside of healthcare, do you see some culture shift and some examples of successful collaborations around artificial intelligence and work between digital health tech and academic health systems to really turn them into learning laboratories?
Well, I found what you said to be interesting, and I want to preface what I'm saying by stating that I believe that we need a major societal reset on the issue of your personal information and digital health. I think it's very confusing right now. We have all the data from your health system is in an electronic health record now. The most important data about your health is out there in the free space of commerce, because we all know the most important data about your health is your social status, your educational status, what you do in everyday life, what you spend money on. Once you get really sick, then the medical side becomes dominant. But if you say what's going to most affect your longevity and functional status, it's going to be the other data, which is freely available now. But I also want to add a couple of things that, I don't think the big tech world has figured out how to handle this yet, because there is a lot of concern about integrating all this information, how it might be used. We need better societal rules. But the health systems also obviously haven't figured it out. They feel like they're protecting something. I feel like it's more the finances that are being protected because they think it's valuable. But what's increasingly obvious now is I can buy data about all of your patients from basically the insurance market and the way it works. There are firms now that have over 180 million Americans' healthcare data. It's for sale if you want to buy it. Now it's anonymized, so you can't link it to an individual. But for the purpose of research, it can be extremely useful. So somehow we got to develop a new set of rules that enable the best technology to be applied in a way that's helpful, in a way that everybody wins in terms of the economies that are developed from it. And I would just say that's a big area of policy we haven't figured out yet. I might mention here, people notice I'm wearing a Joe hat, and since I was a presidential appointee, I don't think I have to make many statements about politics. People know where I stand. I spent a lot of time with Biden while I was commissioner, because he was working on the cancer moonshot and the All of Us project that we put together with NIH. And when I went through my interview with President Obama for FDA commissioner, this was his biggest interest, which was that digital technology was here to stay. It was the future of the American economy. It was the future of American health. And I like to use the term, what can the government do to facilitate? And he said, you got to figure out how to facilitate this, but you also got to figure out how to regulate it, because digital technology can be a great advantage, but it can also put many people at a big disadvantage. And I think in the next session that we have together, we might address that question in more detail. But it was the main focus of our discussion.
Dr. Califf, thank you again for joining us and talking a little bit about your perspectives on academic health systems, electronic health record data, working with across the aisle with digital health tech to develop new sophisticated algorithms and approaches to healthcare delivery. Really appreciate your time and support of our health journal. So thank you very much, Dr. Califf.
You bet. Take care.